Today we welcome Dr. Alison Richardson, a neurologist, to talk to us about the medical condition called Tourette Syndrome. Welcome to the Loft, Dr. Alison.
Thank you for having me.
Now, Doc, what is Tourette Syndrome?
If we look at it simply, it's a neurodevelopmental disorder, and it causes our patients to make involuntary sounds or involuntary movements that we call tics. It often starts in childhood. It often improves in the late teens and early 20s. And although a lot of people kind of think, is this a degenerative condition? Am I going to have it forever? Patients with Tourette syndrome have a completely normal life expectancy. It doesn't affect their intelligence. The tic symptoms often decrease with age. But the problem comes in that the other neurobehavioral disorders that we often see with Tourette's, such as the ADHD, the OCD or obsessive compulsive disorder, and the depression, anxiety, and panic attacks, these persist into adulthood, and these then become problematic later on. Only about 10 to 15% of patients with Tourette syndrome continue to manifest syndrome or symptoms into adulthood, rather.
So let's find out from a neurological standpoint, how is Tourette syndrome diagnosed?
There's not a specific test, there's no blood test, there's no scan that can diagnose Tourette syndrome, and it's based mainly on your signs and symptoms. We use something called the DSM-5 criteria, and this, simply put, is basically multiple motor or vocal tics that have to be present for more than 12 months in generally patients who are less than 18 years old. So we look at the tic aspect, and then we also see, are there any other associated comorbidities that I mentioned earlier, like the OCD, the ADHD, the learning disabilities, and the anxiety.
Now, Doctor, I also want to find out from you, is there a scale or a spectrum within Tourette syndrome that people can exist on?
Absolutely. So if you think about the classic Tourette's is manifested in the movies, that's generally the worst case with the coprolalia, patients who swear or say dirty things. But it can be as simple as a facial tic, such as an eye blink or a grimace. Your vocal tics can be as simple as a cough or a sniff or a throat clearing. So there's a wide spectrum of Tourette's itself. And unfortunately, it's been quite negatively portrayed where they're using the extreme patients. And that's really only 10% of patients with Tourette's who manifest with the severe form of coprolalia.
So then let's talk about the management and the treatment of Tourette syndrome.
At the moment, unfortunately, like most neuro conditions, there's no cure, but we manage the tics. And what I tend to do when I see a patient with Tourette's is I break it down into our medication options, our behavioral-based options, and then there's also a surgical option available. I always try and tailor my plan so that the patient can stick to it, and we target both the tic and the coexisting comorbidities as well, which gives us a way better outcome overall.
What are some myths that we can debunk about TS that will help destigmatize this condition?
A lot of people believe that swearing is a defining symptom of Tourette's. Another myth is that bad parenting causes tics. We know that there is a genetic component to Tourette syndrome, but at the moment, scientists haven't been able to isolate a specific gene, and it is thought that multiple genes interact to give people this disorder.
The global pandemic has had an impact on all mental health issues, but more specifically, how has it contributed to those living with TS?
From a Tourette-specific point of view, we can break it down into four areas. The first is obviously the anxiety that relates to the pandemic itself. So because anxiety is a common comorbidity in Tourette's, which manifests as both the phobias and the generalized sort of anxiety features, we've got the media, and the media's got this relentless, pessimistic media coverage on COVID-19, and this exacerbates anxieties. The other problem is that their OCD, which is already a frequent comorbidity in Tourette's, can become exacerbated because obviously we're now being told to wash our hands. Now, OCD patients wash their hands obsessively, and to try and break that, they're told not to wash their hands when they undergo their CBT. So now we're asking for the opposite of what their sort of obsession is. The last thing is that anxiety can increase your tic severity and is very important in the current sort of pandemic situation. Our next situation is obviously the confinement and the quarantine. These themselves are anxiety triggering. So often patients start to develop tics or their tics become worse.
How then do we find this resolution and this weight lifted off us? Because it does seem as if everything that is set out to help patients with Tourette's syndrome right now under the current pandemic, it seems like all those interventions kind of contradict that.
Well, this is the thing. It has to be taken as a contextual situation. It's generally not an indication for us to alter medication or panic. Some patients do better in confinement because they're with their family, they don't have the social stresses, they don't have to go out. And for them, this has actually been a settling time. So I suppose there's two sides to the coin. You know, there's those who are struggling and then there are those who are doing better.
And that's just a life lesson, it seems like, Dr. Alison Richardson. There's two sides of every coin, but it seems like such a saving grace for those people that have that are dealing better, as much as there's less stimulus, there's less anxiety. So thank you for highlighting what's happening mentally as the neurologist that you are and making it so simple for anyone to understand, even me. Thank you so much, Dr. Alison Richardson.
Thank you so much. Take care.
Please may you head over to our social media platforms, use that hashtag Afternoon Express and lend your voice to this very important conversation.